So what do you do if you've gone into a big cervical facet lockdown? So what that means is if you've got yourself in that situation where you can't turn your neck to one direction, you've maybe got a little bit more to the other direction, extending your neck's real painful, and possibly lifting your head off the pillow is quite painful as well. First and foremost, if you have any numbness, tingling, shooting, loss of motor control or loss of power, loss of strength into your arm, forearm or hand, then you need to go and talk to somebody about this pretty quickly. But if you're just in a regular lockdown where you can't really turn your neck very much at all, then this might just help a little bit. The idea is that lower backs like rest, necks like movement. So we're trying to gently encourage some movement back in your neck, but we're doing it with a little muscle or joint sequencing trick. Okay, so the likelihood is that your rhomboid and your levator scapular muscles have gone into a little bit of a reflexive spasm. So if we get you to go to a wall and rotate your palm, your thumb downwards and your palm outwards, what you're going to do is you're going to activate the muscles at the front of your chest in order to reciprocally inhibit the muscles that are in spasm. Okay, so you're going to just push into the wall and you're going to start with, push in a straight line across to the opposite shoulder really, and you're just going to start to reintroduce or try to reintroduce some of that neck movement that you're losing. So if you've got a big spasm on the right, try this on the right first. Okay, and just try to go through your full range, looking left and right. If this is the correct way for you to do it, then in all likelihood you're going to see some decrease in pain and a decrease in resistance. So you're going to be switching your spasm off a little bit and effectively finding a different way to achieve rotation. It's almost like one pathway has got roadworks on it and you're trying to find a different pathway with no roadworks. Okay, so just looking to your right, we've got roadworks, can't quite get there. Activating all these muscles at the front of your chest and then trying to do right rotation. As far as your brain's concerned, you're now following a different pathway and you're going to perhaps just get there. Okay, if that doesn't work, you can then try pulling down and across to the opposite hip. Okay, so instead of just coming directly across, you're now coming down across. Okay, again against the resistance, hold that contraction and try to reintroduce the rotation. Alternatively, if none of those are working for you, you can try to activate, let's say the spasms on your left, you can try to activate your rhomboids and levator scapula a little bit by taking your elbow into the wall, pulling backwards slightly, pulling in slightly, and just basically locking out the muscles at the back of the shoulder and trying the same thing. You can also try it on the opposite side. So there's 4 options, either chest, either back, and one of those 4 is likely to gain you your rotation back quite quickly. So if you're doing this because you're stuck on your own, you can't get to see anybody and you need to try and get yourself out of pain a little bit, then this might just help. If you're doing this because you've been asked to do it as a reinforcement to treatment, then I will have told you exactly which set of movements you need to follow.